It's such a pleasure to have you here in Slovenia because you bring completely new awareness that nurses, they can have almost the leading role in cannabis treatment. Could you tell us a little bit about yourself and how it all started?
Okay, so I'm the head nurse of a company, Nia Medical. We have a geriatric clinics. We collect data. And I started in 2009 when I used to be the head nurse on Hadarim nursing home. And we had a lot of complication patients that suffer from a lot of diseases and use a lot of medications, but nobody was happy. So I understood we need to find a new solution. And that day, it was on the television, it was a film about Professor Meshulam, Rafael Meshulam from Israel. He is the first to isolate the THC. And in this show, Zach Klein put the opportunity that cannabis maybe can treat patients, but what we need is to take it and learn and teach, or to study, or to make a research, because there's not any research on cannabis. So on that day, we opened a big project. We choose 6 potentially treatable conditions in the elderly population, like pain, insomnia, depression, multi-pharmacy, and spasticity. And all together, we provide one strain, cannabis, to the patients. The way we had on that time, it was only smoke. It wasn't any oil in the world yet. So we saw amazing results. I didn't sleep for 3 years. I changed all my understood about medication and about this plan. We saw the first time the connection between cannabis and Parkinson. We see people feel good. We saw that spasticity, people can move the end. We saw amazing results. So, and I understood that the nurses, she have a critical for the success of the treatment, because nurses with a close figure to the patients, we understand the need, and our gold standard is to educate the patients how to use correctly the medication, and cannabis, it's medication. So I established with Tikkun Olam the first clinic in the world with nurses to educate patients under supervision of nurses, and we collect data. What's between variety and the different diseases? Because in Israel, we're allowed to treat cannabis at the moment in a different indication, like inflammation disease, like bowel disease, arthritis, cancer patients, neurologic patients, is like the Parkinson, Tourette, neurologic pain, of course pain, but still in Israel is last result. And we need to continue this revolution because we see the result. So we took a very serious, Nia Medic took a very serious subject to continue and research what's going to help exactly to the patients, to the elderly patients. Because when you're old, you have a lot of multiple problem. We need to understand exactly all the problem and to know what to provide. So we collect data. We collaborate with Soroka Hospital. This is the second biggest hospital in Israel. And I'm sure we're going to be far away, and we're going to understand more and more when we keep research. Mm-hmm. So this is the reason I came here, and I see what you're doing here. This is the beginning of the revolution. This is a mission. We take a mission to wake up and what the world try to shut down. So already we have 10 years of experience. You don't need to over 10 years. We can share in collaboration with our knowledge and just start to treat patients, baby, children, whatever they need, on the safe side of the cannabis. What we're doing in our clinic, it's after we provide them the cannabis, we educate the patients and we follow up them for 1 month every week to understand what's going on, if they have a side effect or not. We do it in a safe side and to maximize the efficacy of using cannabis.
Mm-hmm. And what do you notice? What kind of side effects do you notice, positive or negative?
You know, everything in the world that you consume can cause you side effect. Cannabis have a side effect, and that's the reason that we create a very strict protocol how to use it in a safe side. Yes, cannabis have a safe side, But still we have to remember that the side effect of the cannabis is very simple compared to the medicine. But still, of course, we are, because let's take old patients, 88, that came to our clinic with 40 medication per day. Now we put the cannabis. It can take the blood pressure down, it can fall down, it can feel confused, or to have a psychoactive sensation. So how many milligram we need to provide to make sure it's not going to be side effect? This is the reason that we work after a very strict protocols to make sure, like we start with a very, very low doses and we climb very slowly. And we use different combination of cannabis for the morning and for the evening for the different reasons. So I believe if the medicine ward, like the nurses and physicians, take care of this, this is going to be more safety. Because, I have to share with you that, when we start to be very famous all over the world, grandchildren said, okay, if my grandma suffer from something, I just go into the street, I buy something and I give it to my grandmother because it's good. So then she don't feel good. She had a very strong psychoactive sensation. The blood pressure can go down. So they call us, please help, what to do, we did something wrong. This is the idea. Of course, cannabis have a side effect. We need to understand the interaction between medicine and cannabis. It's a lot of receptor and molecule that work on the same time. You can take the medicine level up or down. You need to know the combination. We need to do it in a safety way to make sure it's not. So the idea to say cannabis is safety without side effect, this is not the truth. There is a side effect, but still, compared to the medication, it's not that big deal. Like I'm always saying in a lecture, that the most common problem that the patients tell us is dry mouths, because cannabis make you dry, and urine, yeah? So I said, okay, so drink. So this is the most problem, so with this we can handle.
But those side effects that you mentioned, are they reversible? Usually
all the side effect, when you stop using cannabis, it's gone. So it's not any problem. We didn't saw any problem with that, and I have to say that you didn't ask me yet, but about addiction. So all the medicine worried about the addiction about cannabis, and my answer is that our data in our patients, that almost all of them use 45 grams for months. It means they use 1 gram per day, 1.5 gram per day, and they have a beautiful and great result. That means it's not a lot, and people don't need more and more and more. And people stop using it. Our patients, when they want to fly, they feel better, they want to go for vacation, so they just don't use it for a couple of days or couple of weeks and come back and start again. So I didn't. This is not what's supposed to worry us. What very concern me at the moment is that even in Israel, that we have 10 years of experience, cannabis is last resort. After 2 kind of medication failed. This is not fair. Because our problem in the United States, that people die every day, as we see, from opiate. So we need to treat patients by opiate to fail, and then to try cannabis. We have to change.
Mm-hmm. So you and your team, you've been treating and counseling thousands of patients over the years. So what kind of counseling patients need? Probably people are mostly afraid of getting high. So what kind of instructions do they need? What do they ask?
It's very important to give education before you start to use cannabis. It's very important how to consume that, by vape or by sublingual, or when you swallow. It's different methods. It's very important to understand what kind of medication you consume together with cannabis, if it's good together or not. Sometimes it's contraindication, sometimes it's very good synergist. You need to understand the needs, to understand exactly what's the needs, problem, and what you want to treat. You need to educate them for side effect as to falls, especially when you're elderly. And of course, to use the data and not to just to make sure you're not going to try now 100 of product until it's going to work to maximize the success of the treatment. So, of course, education and consulting patient, this is the most important for the success of the treatment, and as I said, the safety and efficacy. And I believe this is belong to the nurse's word.
I believe that. So, I mean, as far as I know, physicians don't have time to communicate a lot.
Yes, and it's different relationship. Nurses, the best closed figure to the patients. We work with them. We close. We understand the needs. We understand his fear, his hope. It's all this detail. It's very important when you consult patients, because if you want to consult patients and to success with cannabis, but at the moment is scared for die because of the cannabis, because he's have all this bad thought about that. So in the beginning, we need to take all the fear away, so we start to talk about that. So I'm a nurse, I'm sitting with uniform, and I'm talking in profession word, and I give her and I share with her all our experience, and then she makes sure, okay, I'm in a safety place, I'm talking to a nurse, she understands my condition, she understands my needs, so they start to trust each other, and then it's for long term, because you know, we treat chronic problem. We don't use cannabis for acute problem. So it's long process, because it's different time, and sometimes it's good, sometimes it's enough, you know, sometimes you feel worse, and sometimes you become better. So you need to follow up the patients and you know, to change the product or the strain, and so the consulting is the most important.
So this flexibility is also important, that you are able to change something during treatment. If something doesn't work, is it often that then another product or strain works?
In our clinic, usually all our patients start with oil, sublingual drops. It's because this is, you know, because the elderly patients, almost all of them don't smoke, and for us it's more comfortable to calculate it. But sometimes, and it's very often, that this traditional consume doesn't work because of side effect. Side effect as stomach hurt, or they don't like the taste, or they don't like the result. So of course, so we go for a different method, for vape or for capsules that they can swallow it. So it's and I believe, like our data, it's not belief anymore, like it's a data, so that to combine between the different methods, oil and vape, if you have a very strong chronic pain. So the oil is for the maintained treatment, and vape is for SOS when it's very hard and you need it immediately. It's not fair to give one drop and wait 40 minutes until 1 hour and a half until it starts to work. So when you can vape it, immediately you can feel relief. So the combination between the variety and the combination between the methods, how you consume it, this is the gold standard.
Do you have cases of overdosing with cannabis, and what do you do in such cases? How does people react, and what are your experiences concerning this?
So first of all, I want to make everybody comfortable. Cannabis is never going to poison you. Cannabis never going to poison you. But of course, when you consume a new compound of THC that your body don't use to it and your brain don't use to it, it can cause a panic attack, it can cause uncomfortable feeling, but this is the most worst, yeah, is nothing worse than that gonna happen, probably, but when you feel panic attack, you are very scared. So don't run to the emergency room, you don't need to, they're just gonna make joke of you.
Not in Slovenia.
No, Slovenia. Yeah.
I'm very serious.
Yeah. So in the beginning in Israel, like people went to emergency room and said, "I'm going to die. My pulse worked very hard. I'm going to die," and it's like and they understood it's because THC, so they start to make fun and joke of that. And the reason, like, we established the clinic, is to make sure people not going to run anymore to the emergency room. So just come down, understand that this is side effect, that what you experience now. Just drink and eat sugar. Sugar help the brain handle with that. But it's not poisoned, it's not dangerous.
Yeah.
So you don't need, so don't be worried about that. Just make sure somebody with you, drink, rest, make sure your blood pressure is stable, line with up leg, listen to the music, it's going to over. If you use it by drop, you're going to have 6 hours, maybe you don't going to feel good. Make sure you're not alone. You call somebody and start to make yourself more comfortable, it's going to over. The only reason that I say that if something wrong happened to you, or when you start to consume cannabis, make sure you're not alone. It's always more nice to be with family. But the problem is that if the other caregiver don't have experience, so you fear and you make him fear, and this is the circle. So try to be with somebody that have knowledge a little bit about cannabis. And second, remember, it's going to over. Don't worry. If it's not going to over more than 6 hours and something very wrong go, like psychoactive, a very strong sensation, make sure you're going for help. But this is so uncommon. So people handle the, and after they make joke of that and they get used to it, so don't worry.
You also develop trust. How important this is for treatment?
For every treatment in the world, you need to make sure as a nurse that the patients trust you, believe you, and you understand him, and you make a very good relationship between you as a nurse and the patients. This is very important for every treatment in the world, especially in cannabis, because you're going to feel it. It's going to be changed. It's different than what you know already. And because as a nurse, as we mentioned about a knowledge, and when you professional, so the patients can trust you. And I'm always say, like, you have to be careful as a nurses not to promise what you cannot. You know, sometimes call me a parent that they have a very suffer children, and I never promise what I cannot. I wish I could, but I'm not God. Mm-hmm. So you need to be honest. You need to use the right knowledge that you know, and to make a very good atmosphere, a treatment atmosphere with the patients, and then you build the trust.
Mm-hmm. In many countries, also in Slovenia, people mostly still don't tell to the physician that they are using cannabis for treatment. How do you think the physicians will build this trust between, especially concerning cannabis treatment?
Yeah, I know this situation from Israel. In the beginning, people was really scared. Even now, like, they tell me as a secret, you know, I'm already trying and it's helped me. So we know that people, like in the beginning it was more naive patients, now it's less and less naive patients because people hear and they try. Okay, so they didn't find the right medication for them, but they have any experience. And of course here, since the physician be against, of course, how can you share somebody that against you? This is not build a trust. So the physician judge the patient and you feel uncomfortable. So this is not the right way. But until the physician's not going to feel comfortable with cannabis and they're going to understand and learn the knowledge about the endocannabinoid system, about the cannabis product, so they're not going to feel comfortable with that. And you know, it's still many kind of physician. There's a physician that said, listen, I don't want to know, don't tell me, continue do whatever you want, but don't tell me. The another group of physicians say, like a judge, like how you do it is very dangerous, you're going to die, or give him a very bad idea of that. This is very incorrect and not fair. And this other group of physicians said, you know what, if you try, let me know what you're doing because I want to understand what's help you. So, of course, it seems that it's going to be bad atmosphere, the patient's going to be concerned and feel uncomfortable with the health system.
Of course, it is important to have researches and clinical trials, but most of the physicians is just waiting because of it. Do we need to wait to start treating with cannabis?
No, we believe that we need to provide, because of the safe side of the treatment, to do it right, but to continue to provide cannabis as for severe condition, I'm not talking about fun, I'm talking about severe condition, a very hard degeneration disease, yes, to do it, because it saves life, it saves the children life, and it's make patients feel more comfortable, less pain, more well-being, and this is our obligation. This is the reason I'm a nurse. I'm trying to help people feel better.